I thought cancer was something that usually happens for people of older age, not at my current age. So I was kind of scared. And so I didn't know what the steps were, but the entire Riverside team rallied around me to make me feel comfortable. And that took a lot of the fear out of what the word cancer had to say. My name is Regan Prince. I live in Suffolk, and I'm 56 years old, and I was diagnosed with prostate cancer in the spring of 2022. Dr. Sutton, my primary care physician, we noticed that there was an increase in my PSA levels, and then he referred me to Dr. Doviak, and he performed a biopsy, and from there, it was determined that I actually had prostate cancer. We sat down and discussed some different treatment options, and so after consulting with the various doctors in those respective fields, I decided to go with the stereotactic radiosurgery program.
When patients get diagnosed with prostate cancer, they're faced with various options of how to treat it. The main choices are to have surgery or to have radiation. As far as the radiation options, the main choices are whether to proceed with IMRT, or intensity modulated radiotherapy, or SBRT, which is stereotactic body radiotherapy. IMRT uses a special form of technology that allows us to shape the beam precisely so only the prostate gets most of the dose. SBRT does the same exact thing, but it does it quicker. So instead of coming in for treatments once a day, 5 days a week for several weeks, SBRT allows us to make it happen in 5 treatments. You may also hear about the proton therapy. That's a different form of radiation. It does the same idea in the sense that it treats the prostate while trying to avoid those other organs. The national guidelines, including American Urologic Association, ASTRO, and National Comprehensive Cancer Center Network, all published guidelines saying that protons and photons have the same outcomes as far as side effects and cancer control. Now, we work at Riverside very closely with the urology colleagues to decide which patient qualifies for which. As far as the radiation options, the prostate needs to be on a smaller side to qualify for SBRT, and the cancer has to be lower risk or intermediate risk for the patients to qualify.
There are a few other advantages that we have in terms of patient convenience. One is that we do not require a spacer to be placed between the prostate and rectum. And the reason we don't need that is because our precision is high enough that we haven't had problems with the rectum. What we have at Riverside is a CT scanner that's attached to our machine, which we can visualize the prostate in 3 dimensions, and then we can arrange any adjustment that needs to be made from our initial plan to what needs to be done on that particular day. Well, when we're doing stereotactic treatments, they'll generally take 30 to 40 minutes. But the patient can lie still in a framework that supports their body, breathe normally. They won't feel the beam. It's an easy treatment to take. And I'm sure if you talk to patients who've been through it, they'll let you know it was the easiest thing they could imagine.
The stereotactic radiosurgery process was minimal to no side effects, and it wasn't quite as demanding on family, to care for me, post-surgery, had I went with the surgery option. So that was a deciding factor in going with the stereotactic radiosurgery. It's been a very professional journey. The staffing, I think they're one of the best staff. They're very timely, and they make you feel very comfortable with the process. A lot of people always say, or they feel like, oh my gosh, cancer that's the end of the world. Well, it's not. It's not the end of the world. Go ahead and get your treatments, and go ahead and do what you have to do and enjoy the rest of your life.